the room.
Good afternoon. My name is Dr. Oluwaka Adekomolafe, one of the junior doctors in pediatrics department.
Oh, doctor, how is my son? Is he all right? Is Ryan fine?
Yes, thank you. But before we go ahead, will you please tell me your full name?
Yes, I'm Melissa Howard. I'm mother of Ryan Howard.
Oh, thank you. How old is Ryan to make sure that you're on the same page?
Yeah, he's 5 years old. He was just admitted. Just tell me what is happening, doctor.
Okay, I understand you. Ryan is in safe hands. Has anybody told you what happened to him?
I was in the park and he got hit by a car and I just brought him here. Nobody told me anything.
Oh, sorry about your condition. This must be quite a very challenging time for you, but we are going to do everything to help Rian and to help you. Now, Rian, like you said, was involved in road traffic accidents, and we conducted X-ray, which shows that Rian sustained fractures around the hip, which need to be fixed in the theater. That is the situation of things now.
Oh my God, doctor, what do you mean? So he has to go for surgery?
Yes, because the case will not heal on its own unless it is taken to the surgery to fix. Do you have any special worries concerning this case?
God, doctor, that's not fair at all. Oh my God, it's all my fault.
No,
I
it is not.
I should have taken care of him. It just happened in front of me. Oh my God, doctor, is he
I
going to be
understand.
fine?
I understand you well. I know the way you feel, and I'm telling you, many people will feel the way you feel too. But I'm assuring you that Rian is going to get better. What we need at this time is to give you a form or consent form for you to fill, giving us the permission to carry out the surgery.
Yeah, absolutely, doctor. Whatever needs to be done, I just want him to be safe. My God.
Rian will be safe. But before we do the surgery, I need to explain certain things to you. Do
Okay.
you have any questions to ask concerning the surgery? Any specific questions?
I mean, what surgery is it going to be? I mean, surgery is very scary, doctor.
I understand you. And if I were you too, I may feel like that. But the surgery is an orthopedic surgery to make the two parts of the bone that are unstable to align them together. But like all other surgeries, surgery carry its own risk. Are you with me?
Oh, doctor, is he going to die?
No, it's not going to die. It's going to be in best hands. But one of the side effects of surgery is that one, there may be blood loss during the surgery. It's inevitable. You may need to receive blood transfusion in the course of surgery. Then two, there may also be infection because there's going to be a cut. So there will be scar formation. Do you understand? Do you have any concern, any question to ask about this?
I mean, what is going to happen to him after the surgery? How long will he be in hospital?
Well, I cannot adequately answer that question now. But what I know is that this surgery will not last more than 1 hour. But how long it's going to be in the surgery depends on his state of health, his response to treatment, and wound healing. But being a young person, within a short period of time, he should be out of the hospital.
Will there be any permanent complications?
This is a very valid question. In order for it not to have experience permanent complication, the management will be multidisciplinary. Do you know what this means?
No, doctor.
Thank you. What it means that in addition to the doctors and surgeons attending to him, there will be other health workers, specialist nurses, physiotherapists that will be involved, that will take part in the rehabilitative process.
Okay.
Do you understand? So they will make sure that it does not develop any weakness of the limb or any permanent disability.
Okay. Okay. That sounds
Thank
good.
you. So we are going to give you the consent form for you to fill, and as soon as you fill the consent, then we'll go to the theater and we'll carry out the surgery, and in a short period
2 minutes
of time,
remaining.
Ryan will be back into a recovery room. Do
Okay,
you have
doctor.
any?
When can we see him?
Oh, we can see him as soon as the surgery is over. But before we go now, we will give you chance to speak to him and reassure him that everything will be well.
Okay, sure, doctor. Is he awake right now? How is he doing?
Yes, he's awake right now. The surgery will commence very soon, so he's going to be under anesthesia and he's not going to feel the pain.
Okay, that's good because he was crying so much, doctor. I couldn't take it. He must be in a lot of pain.
Okay. Has Priya been admitted in the hospital before?
No, never. This is the first time. He's never even had
Does he
any.
have any allergy to any food or medication?
No, doctor, not that we know of.
Does he have any respiratory problem?
No, doctor.
Is he taking any long-term medications?
No, doctor.
So Ria is good to go. There is no problem. I want you to be rest assured that Ria will come out of this and will come and bounce back in a stronger way. I will give you more leaflet to read about surgical operation and pelvic fracture. Then I will also connect you with social workers who may be of help, because managing condition of this kind of case may be draining on your finances. Are you okay with me? Okay.
Yes,
All
doctor.
right.
Thank you.
Okay. Thank you.
Move on to the next station. On to the next station.
Not bad, not bad. So, do you know the spikes protocol?
Yes.
So,
Yes.
I think you should try to follow the spikes protocol. You didn't really follow that, did you? So, you did well. You kind of explained the condition well, but the thing is, you know, delivered the news really too soon in the beginning. Just 1 second. Okay, okay. So, what I was saying is, did you notice that it's a unstable pelvic fracture?
Okay.
So one thing is that this is a breaking bad news. You understood that point, right?
Okay.
You didn't realize that. So, yeah. So basically, the thing is, the child had a pelvic fracture and he's going to surgery because he's unstable, right? And it's basically at one point I asked, is he going to die? You said no, he's not going to die. How do you know that?
Just
So
to reassure the mother.
But yeah, there's never any absolutes. All right, never say no directly. That whatever the question is, uh, when they ask these things, just say it's highly unlikely that he's going to die. Instead of saying no, he's not going to die. What if he actually dies? She's gonna come after you. Right. So there's no absolutes at all in medicine. All right, you can never say for certainty that somebody is if some treatment is going to work, or if somebody is going to get better or somebody going to get worse. All right, there's never any certainties. You always say it's highly likely that he will make it, or it's highly unlikely that he's going to die. So always keep that also in mind. Never say like no, he's not going to die, he's going to be fine. Right, that's one thing. But yeah, so Spike's protocol, maybe because he didn't realize that this was not breaking bad news, that's why he didn't probably use the Spike's protocol. But technically you broke the news very early, so always do more data gathering before you actually give your management. Okay? So here the management is basically you telling them the news of how the what is going to happen to the child. But before that itself, you need to ask more questions. So you did the data gathering at the end where you asked allergy and medical conditions and all those things. But you could have done that in the beginning itself.
I was thinking that with the way the mother came, that just only reassured the mother.
Yeah, you can reassure the mother without actually giving the news first.
Okay.
So you can reassure the mother saying, "Don't worry, he's in safe hands. We are doing as the best that we can." And then you say, "I just need to ask you a few questions, and so just so we're on the same page." And then you ask what exactly happened, and then ask, "Are there any? How is he before this? Does he have any other medical conditions? And does he take any medications? Any allergies?" And then you break your news in layers. That also you have to do it very slow, you have to do it in at least 3 sentences, right? You start by saying, as you know, that he's had a rotational accident that you mentioned, and then after that you need to say that we've taken an X-ray and it showed a fracture, and then pause there and then say, unfortunately, it's an unstable pelvic fracture, and he's going to need a surgery. All right. So you have to always give it in at least 3 sentences, right? That is your delivering your bad news. Let's just check the checklist.
Have a workbench for this case at least. That would be nice.
Yeah, we can actually go through the workbench and how to do this. Yeah. So basically, setting, introduce yourself and your role, ensure privacy. So this is basically this is okay. You don't need to mention that. But first, confirm the patient identity and relationship to Ryan. Ask what they already know about Ryan. Gently inform that he's not currently doing well and explain the current situation. Before you do that, there's something called an invitation where you have to give a small,
Invitation.
You need to say a small sentence about the fact that you're giving them a difficult news. So before you deliver the actual news, you need to tell them to basically brace themselves. Like, I'm sorry that I need to tell you about the situation. He's currently not doing well. And pause, and then you give the actual news, right? Or you can say, you can even ask, do you want somebody to be there with you right now? So that's another way of giving an invitation where they'll know that, okay, there might be a bad news that's coming, right? So that's one way to give the invitation. And then knowledge is basically you start with say that he was in a accident, and X-ray findings show pelvic fracture and there is a need for immediate surgery. And then the emotions. So when the emotions came, you need to give them some time to process, give them some time to say things instead of saying that no, when I said that, oh, it's my fault, I shouldn't, I should have taken care of him, you shouldn't immediately say, no, it's not, things like that. You should immediately explain what the emotion the patient is showing. All right, that's very important. So there's something called EVE protocol, EVE. So that is emotion, is identify the emotion, validate the emotion, and then empathize. That's the EVE. So identifying the emotion means you need to say it in words. So whatever the emotion the patient is showing, you need to say that back to them. I can totally understand that you're upset, you're feeling guilty right now, and it's absolutely valid that you feel that way. But I can totally assure you that he's in safe hands and it's going to be all right. Right, so you need to deal with the emotion in a way that the examiner understands that you picked up on the emotion. So so whenever you see any emotion in the patient, just say it back to them. I can see that you're upset, I can see that you're angry, I can see that you feel guilty. So always just repeat it back to them. That's very important. And strategy and summary, this is good. You covered, you talked about the surgery, and you talked about the consent that is required for it, and you talked about the possible complications, and mentioned that the surgery is going to be just 1 hour. That's also something. Don't make up things like that. You don't know that. So always say that, oh, I'm not really sure at this point. The surgeons are going to take a look at it, and once the surgery starts, we're going to be able to give you much better information. All right?
I'll keep you informed.
Yeah, I'll keep you in loop about what is happening. So make sure you never assume things, never make up information. That's very important in PLAB 2. Whatever the information is in the STEM, that's the only thing that you need to talk about. All right?
Okay.
Yeah, but other than that, yeah, everything else is fine. So the main point that you missed is safety netting, follow-up. So safety netting here is mainly for the mother. So you need to be sure that the mother is mentally stable. So talk about, ask them like, is there somebody with you right now? So that's how your safety netting, for the fact that she is not going to go into a depressive episode at that point, because she needs support, right? So do you want to call somebody to be with you right now? That's something that you need to do as well. All right. And signposts of the conversation. So this is one thing that you're doing signposting in most of the things, but you're phrasing it as a question. You don't need to do that also. That's something that I wanted to tell you before. In other cases also, you don't need to say, I'm going to ask you some, I need to ask you some personal questions, is that okay? So you don't need to take their permission for that. You just need to tell them that, oh, I just need to ask you a few personal questions, and then you just ask the question. All right, that will save you some more time as well in data gathering usually. But yeah, other than that, it's fine. This is also like, if you had realized that it's a breaking bad news, maybe you would have done better. But yeah, other than that, you're on good track.
Please like and subscribe to Turing Med School. Good luck with your preparation.